We're going to have now Brook Biggin, which is a queer HIV-positive community organizer residing in Edmonton, in the Prairie Regional. He's the Prairie Regional Manager of the CBRC, where he's responsible for management and oversight of advanced activities across the provinces of Alberta, Saskatchewan, and Manitoba. He's also the founder and current chair of the Edmonton Male Health Collective, a grassroots health organization run by and for LGBTQ plus men, as well as the co-chair of Alberta's SCTVI Operational Strategy and Action Plan. Welcome, Brook.
Hi, everyone. How are you doing? Okay. We're going to get through this as painlessly as possible. So I work in what's known as the Prairies, and so when many of you think of the Prairies, you probably think of something a little bit like this. Or maybe like this. I have been to a gay rodeo in Alberta. It was quite a lovely experience. And maybe this. So for those of you, hopefully not. We'll see. But really, when we're talking about the Prairies, we're talking about the three provinces of Saskatchewan, Alberta, and Manitoba. Now, when you begin to look at these, oh, there's my meme, sorry. So when you begin to look at these three provinces a little bit closely, you start to figure out that they're not actually all that similar. And so when you begin to look at populations of each province and major urban centers, different provincial governments, different structures to their health systems, and then even some of the key priorities that we're looking at, such as access to ARVs or universal PrEP access, we're talking about very different scenarios in each province. And so I think that leads us to the question of why the Prairies, right? And I'll just say as somebody who lives in the Prairies that we don't know why. I think that they just look at what's between BC and Ontario and say, there you go. But we actually don't necessarily do that much work together. And so I always think it's important to recognize the opportunity that we have to be more equitable when we start looking at regional representation. And the reason why some of these provinces have been shoehorned into regions that don't make sense is because we've collectively allowed that to happen, but we can also collectively not allow that to happen. And so hopefully this can be a start of the conversation. In the meantime, though, we'll take what we can get, so thanks for thinking of us. And so, as we try to approach it, even though we have 4 different sites and people on the ground, because it's being managed centrally, we have to look at some similarities between these provinces, which can look quite different. And so, for example, and some people might not be familiar, we have 3 of these provinces. When you look at HIV rates from 2016, are the first, second, and 4th highest HIV rates amongst provinces in the country. We also have about 40% of Canada's Indigenous population that lives amongst these three provinces, as well as the 2 largest urban Indigenous populations in Winnipeg and Edmonton. And so you'll see as we approach this region, when you look at who we pay to do the work, who our partners are, where we invest our resources, that's reflective of this. As well, the other thing that's key when you start to look at the similarities, and this is what we've really latched onto with our approach, is the fact that these provinces have typically had, at least at the inception of the project, a lack of a well-established ongoing queer men's health organizations that are adequately resourced to confront the challenges that face the population. And so it's actually quite a fit for this project. So we do have organizations who, with the limited resources that they have, are having challenges making the impact that they want to have. And then also we're working with a similar pot of resources across a larger region. And so we're also not adequately within this project resource in the region to have the impact we want to have. But perhaps if we work together, a little bit of like a win-win, we can have the kind of impact that we'd like to have. And so as you see here, these are really the 4 main sites that we're working in. So Edmonton, Calgary, Saskatoon, and Winnipeg. And so you'll see we have key partners in each region. So in Edmonton, the Edmonton Men's Health Collective. In Calgary, the Center for Sexuality. In Saskatoon, out Saskatoon, and in Winnipeg, we have a variety of partners such as 9 Circles and the Collective Impact Network, as well as the 2 Spirited Peoples of Manitoba, and Albert McLeod is here, I don't believe in the room, but here at the summit, if you get a chance to speak with them. So across these 4 sites, you'll see that there are about 11 different individuals working in various capacities on these project activities through a range of contracts and partnership agreements. And we really are approaching them at a provincial level, so we're not doing this work regionally because, like I say, doesn't really make sense in a lot of cases, and so we're really doing it province by province and in some cases site by site with intentions to ideally expand and scale up throughout the rest of the term. And this just kind of gives you a breakdown of how some of our staffing works with these relationships with core partners. So for example, in Edmonton, through a partnership with the Edmonton Men's Health Collective around community health leadership programming, there are about 5 individuals who are supported through a mix of resources from the Edmonton Men's Health Collective and the CBRC, and because we're working together toward similar goals. Just to give a quick rundown, because I know we don't have a lot of time. Is that 1 minute or is that 5 minutes? Oh, I'm doing good. Okay, it's green. It would be helpful if it said what it meant, but anyway, sorry, Jose. And so in terms of formative research, so talking about what some folks have mentioned so far, really in Alberta, we've done about 20 key informant interviews with everybody from, community leaders straight through to the provincial director of the STBI program. We've done about a dozen in the Saskatoon area and about a dozen in Winnipeg. We've done 2 community discussion groups in each site, except for Edmonton, because one of our partners, the EMHC, will be doing consultations related to a couple different projects, and you can out-consult communities very easily, so we're going to wait to see how that goes and if there's a way we can support that work. Around Sex Now, 3 of the in-person Sex Now deliveries happened in the region, and so in Calgary, Edmonton, and Winnipeg. And unfortunately, there were none in Saskatchewan, but the online version will be available there. And so I think we're going to really try to invest some additional resources to try to get a solid number from that location. And then, of course, we're really just looking to leverage what's existing work in the region. And so, for example, in Winnipeg right now, the Two-Spirited Peoples of Manitoba are doing a community readiness assessment, and we see alignment there. And so they need a little bit of support. We've got a little bit of personnel support, so let's work together toward that. And so we're excited to partner with them. Around stakeholder engagement and knowledge mobilization, I don't know about you, but I need another meeting like I need appendicitis, right? And so I'm not really like a fan of like starting a new coalition or a new whatever. And so we're really leveraging existing mechanisms where they exist. So the provincial STBI strategy, which I co-chair, so it's pretty easy to get meetings with the people that we need to. There's provincial project teams to some of our partners. In Manitoba, they already have a Manitoba Collective Impact Network that already has all the stakeholders that we want to engage with, so why create something new? So we're in conversations about potentially maybe even having a queer men's health subcommittee of some sort, and actually on November 30th, we've been invited to a meeting to actually present some preliminary results from the in-person collection in Winnipeg, so we're really excited about that. And at the end of the fiscal, we're working on work plans, so we won't say exactly where it is. But at some point, we'll be having regional stakeholder forums in each province. And then we're going to take all this formative research, all the Sex Now data, sit down with our key stakeholders and say, what are your priorities? What interventions are you interested in piloting to address these priorities? And then we'll be delivering pilot interventions in all 3 of these provinces, possibly at each of the 4 sites. Around community engagement and intervention development, again, some of the groups are doing community engagement committees, but, we had funding for like 1 engagement committee across the entire region, and because we're approaching it provincially, it didn't really make sense, and so we're able to leverage an intervention within the CBRC called Smarter Prevention, which is a community health leadership program that focuses on community health advocacy. So we're leveraging that intervention and actually piloting it in all 4 sites this upcoming spring, as well as in Vancouver and Halifax. And their community members they'll learn community health advocacy skills and actually get to apply that tangibly through informing intervention development and actually participating in the design, implementation, and evaluation of those interventions. So we're quite excited about that. I think I'm like on time. Okay, well, there you go. So how much time do I have? A few jokes, right? No. So moving forward, again, we're taking it slow because we're working with a broad coalition of partners, right? So it's taken quite a while to build up this network, but we have a great set of partners that are walking with us. This is some of them there from across the province. Thank you for your time. This is 1 minute, right? I still have a minute. No, I'll turn it over to Simon. Thank you. You've been lovely.